Guys, in this video, let us focus on facial nerve. Basically, facial nerve is cranial nerve 7, correct? So basically, it is the 7th cranial nerve. We have already seen cranial nerve video, right? So from the base of the brain, you have seen it will emerge and you have the facial nerve, which is the 7th cranial nerve here. Okay. So today we will discuss only on facial nerve, from where it originates, what it does, where it goes, its path, ganglions, etc. Okay. So basically, if you see the cranial nerve 7, right, that's the facial nerve, it has mixed activity. Okay. So it is both sensory and motor activity it has. So first of all, let us see from where it originates. Okay. So where can you spot the facial nerve, guys? Here, can you spot the facial nerve? Have they mentioned anywhere here? Sensory root of facial nerve, motor root of facial nerve. So both are marked here, right? So you have the facial nerve, 2 roots also mentioned here. Motor root and the sensory root of facial nerve. So which part is this? Which part of the brain is this? This one is the pons, this one is the medulla oblongata, okay? So basically the 7th cranial nerves arises out of the pons, okay? So this is another diagram here showing the pons, and here you have the medulla oblongata, and here you have the midbrain, okay? So basically midbrain, pons, medulla oblongata, and from the pons you have the, here you can see the facial nerve, motor root and sensory root. Okay, can you see here? Motor root and sensory root. So motor root and sensory root of facial nerve coming out of where? Out of pons. The facial nerve, the 7th cranial nerve, has action in parasympathetic. Parasympathetic activity also is there. It is there in the parasympathetic system. Okay, facial nerve. So what and all have you understood so far? Facial nerve is what? Cranial nerve 7, it is mixed nerve, it is coming out of pons, it has motor and sensory root. Okay. It has motor and sensory root. Okay. It is there in parasympathetic system. Parasympathetic system, it is a part of that sympathetic system. Okay. So now let us look at the details. So what are we looking at today? Facial nerve. Which cranial nerve is it? It is the 7th cranial nerve. What does it do? It actually helps in smiling, crying, there is lacrimal gland, tear secretion, and taste. Okay, and also general sensation. So all this it helps in. Okay, what and all it helps in? Smiling, tear secretion, taste, general sensation. Okay, so these are the functions. So basically, what did you understand? It is the 7th cranial nerve. It is running from pons to the parotid gland. It has both motor and sensory root. It is part of sympathetic system. It is supplying the lacrimal gland, the salivary glands, right? Then let us see what else it does. Basically, the anterior part of the tongue. So if this is the tongue, the tip of the tongue, right? There, the taste is because of facial nerve. So that is why taste sensation, the tip of the tongue. Right? Chorda tympani, the chorda tympani branch of the facial nerve, okay, which is carried by the lingual branch, okay. So the anterior 2/3, so if this is your tongue, the anterior 2/3 of your tongue, the taste is because of facial nerve, that is the chorda tympani branch. This much you have understood, right guys? Good. So that is about facial nerve. We have to look at a lot of details, hold on. So basically facial nerve has so many components, okay. So basically facial nerve components are like, there are 2 efferent, okay, which are going out, and 2 afferent, which are coming in. So what do you think will go out? It is pretty easy to understand. Motor things will go out. So motor and secretomotor are going out. So facial expressions are motor, right? That is facial expression. You make some facial expressions. And if you're secreting tears, all that is going to be the efferent pathway. So basically salivation, because of submandibular gland, sublingual glands, they are doing salivation with the help of facial nerve. Okay, so these are efferent. The nerve is telling what to do, right? It is telling the muscles to move, facial expression, secrete, etc. Now what is afferent? Afferent means some information it needs, no, some input it needs, right? The nerve itself. So that input, so you have again input here, special input will be taste. So you are able to know whether it is sweet or whether it is salty. How will you know? Because anterior 2/3 of the tongue, right, is controlled by facial nerve. So you will know sweet, salty, all that because of facial nerve. Okay. Then what else are the inputs that the facial nerve are getting? It is getting proprioception sensation from facial muscles. Proprioceptive sensation from facial muscle, right? And then also from tympanic membrane, right? From tympanic membrane, from concha, that is the ear, right? The pinna, part of the pinna, concha, right? Then from the canal, ear canal also, external canal. From all these places also it will get the information, right? So general sensation from all these parts. So you know what these parts are, right? Or we should explain that. So basically, if you look at the ear anatomy, so this becomes the concha. From this and some part of the external canal, the posterior superior part, and the tympanic membrane, right? All these, the sensation, general sensation is sent to what? The facial nerve. Okay. So facial nerve will receive the general sensation from tympanic membrane, concha, external ear. Also from the face itself, the proprioception of the facial muscles, right? The proprioception means what? You know exactly which location it is, in which position it is. That is proprioception, right? That is all sent to the facial nerve. So guys, now you have understood that the facial nerve has motor root and sensory root. So motor root, it comes from a lot of places, sensory root some places. Basically you should understand that the facial nerve has some parts. Okay, let us look at those parts now. So the facial nerve has three parts here where you can say it has the intracranial part that is within the skull. Then you have the intratemporal part. Then you have the extracranial part. Okay. So intracranial is from the pons to the internal acoustic meatus. Where is this? That is, let us look at this. So from the pons to the internal acoustic meatus, they are calling it as the intracranial part. Then you have the intratemporal part, that is from the internal acoustic meatus to the stylomastoid foramen, from where it is coming out of the skull here. From the stylomastoid foramen it's coming out, right? Then you have the extracranial parts. So here you can see the stylomastoid foramen being pointed at, right, in the skull. From this hole the nerve will come out, right? Are you able to look at the mastoid process here? This one, mastoid process, looks like that, right? So this is from where, the facial nerve will come out, okay? Guys, mainly focus on this intratemporal part, okay? This intratemporal part is very important in ENT, okay? So let us look at this intratemporal part of the facial nerve, okay? Let us look at this. Basically here, from where to where? From the internal acoustic meatus to the stylomastoid foramen, you have this, right? So from here, from the internal acoustic meatus to the stylomastoid foramen, this part they are talking about, okay? So here you have the meatal segment. Here you have the labyrinthine segment, okay? Then you have the tympanic, tympanic or horizontal segment, okay? Then you have the mastoid or vertical segment. Guys, pay attention here. What are we looking at? We are looking at the intratemporal part of the facial nerve. There itself there are four parts: meatal segment, labyrinthine segment, tympanic or horizontal segment, and the mastoid or the vertical segment. Guys, this diagram may help to understand this. Okay, so look at this closely. So you should have a meatal segment, labyrinthine segment, tympanic, mastoid. Let us look at this here. So this is the internal acoustic meatus from which it is coming. Here you have the geniculate ganglion. Then you have the horizontal part here. Then you have the vertical part here. This horizontal part is the tympanic part. Then here you have the mastoid or the vertical part. Okay. Is this clear, guys? Then here you have the stylomastoid foramen from which the facial nerve is going to come out. Okay. So if you look at the parts again, here you have the internal acoustic meatus, meatal part. Then you have the geniculate ganglion. From the geniculate ganglion, here they have shown the first branch actually. This is the greater petrosal nerve, which is a branch. Okay. Then you have the tympanic part of the facial nerve, which is above the foot, the oval window. You can see the oval window here, above the oval window, and below the lateral semicircular canal, you have the horizontal part of the facial nerve. Then you have the vertical part of the facial nerve, that is the mastoid or the vertical part of the facial nerve. So about the vertical part, it is from the pyramid to the stylomastoid foramen. So you saw here the stylomastoid foramen. So it is from the pyramid. Here you can see the pyramid, right? Pyramid to what is attached to the pyramid? The stapedius muscle is attached. So from the pyramid to the stylomastoid foramen, you have the mastoid or the vertical segment. And they are calling it as the second genu, second bend. Okay. So this is pretty clear, right? Guys, remember, now this facial nerve has come out of the stylomastoid foramen, right? And there are a lot of branches of the facial nerve. You should know the branches. Okay. So the greater petrosal nerve is one of them. The first branch is this greater petrosal nerve. Then you have the nerve to the stapedius, chorda tympani nerve, posterior auricular nerve, right? Nerve of posterior belly of digastric stylohyoid nerves. Then you have the fifth terminal branch of facial expression. Okay. So this is what is temporal, zygomatic, buccal, mandibular, cervical branch. So this is what they are calling as the 10 zebra bit my, what was that? 10 zebra bit my cat. So that is what they say here. 10 zebra bit my cat. That is the mnemonic here to know the last 5 terminal branches. That's all. There are so many other branches. Just for the last 5 branches, they have kept one name here. 10 zebra bit my cat. That is temporal branch, zygomatic, buccal, mandibular. This is mandibular and this is cervical branch. That is the cat. Okay. 10 zebra bit my cat. Just for those last 5. But other than that, there are a lot of branches. So you have to know here the greater petrosal nerve, which you already have seen in the previous diagram. Then you have the nerve to stapedius, the stapedius muscle in the middle ear, right? That muscle, you saw that small muscle which holds the stapes bone, that one. Right? So what and all nerves are there, guys? Greater petrosal nerve, which is shown here. The greater petrosal nerve. Then you have a nerve to the stapedius muscle. Then what else you have? As terminal branches. You have the chorda tympani nerve, which you saw the anterior 2/3 of the tongue. Right? Then you have the stylohyoid nerve, a nerve to the posterior belly of digastric, posterior auricular nerve. So all these nerves are going to be there, right? Then you have these 5 branches: temporal, zygomatic, buccal, mandibular and cervical. Okay, for facial expression. Remember this, for facial expression, that is the motor part, the facial expression, for motor movement of these facial muscles, you need the facial nerve. But for the sensation, right, you have the trigeminal. Trigeminal will control the sensation of the face. So guys, forehead, right, our forehead and our lower face, everything has innervation from the facial nerve. Forehead gets from both the cerebral hemispheres. That is why it usually is not affected that much. Okay. However, the lower face receives the innervation only from one hemisphere. Guys, you can see the facial nerve here. Arrangement of facial nerve is like a foot of goose. Okay. Have you seen a foot of a goose? Something like this it will be. We'll try to draw and show. A foot of a goose will be like this. Something like this. So let us say this is a goose. Its foot will be something like this. No. So that is why they have said that pes anserinus means the goose foot of who? The facial nerve. Facial nerve inside this parotid gland, it is dividing into these 5 branches, right? You saw That is the temporal branch, the zygomatic, the 10 zebra bit my cat, temporal, zygomatic, buccal, mandibular and cervical, right? And you can see the parotid glands duct, the Stenson duct, it is running between the buccal branches, right? This is the buccal branch, both of these together. Between these two buccal branches, the Stenson duct is there, okay? Guys, in this video, mainly we have focused on the course of the facial nerve only, okay? We are not looking at its blood supply, paralysis, what happens, that and all we are not looking at here, okay? That itself will become so huge, the pathologies, etc. So, facial nerve, basically the root, you have seen what it does, right? So, if you want to check somebody's facial nerve, right, how will you check, guys? So, you will ask them to raise the eyebrow, you will ask them for taste, right, anterior part of the tongue, sweet, salt, all that taste you can ask, okay? So, that is facial nerve test, okay? So, guys, you would have heard of Bell's palsy, etc., right? So, you should know that what happens if there is facial nerve palsy, right? There will be loss of lacrimation, okay? If there is involvement of greater superficial petrosal nerve, then there can be loss of stapedial reflex, lack of salivation, loss of taste sensation, paralysis of the facial muscles, right? So, you can try to make out the site of injury also, where exactly this injury has happened also you can say, right? Basically, if all the 5 symptoms are present, that means if all of these, that is the lacrimation is not there, stapedial reflex is not there, salivation is not happening, taste sensation from anterior 2/3 is not happening, paralysis of the facial muscles, if all these are happening, then you can sometimes say where exactly the problem is, right? So, if all the 5 problems are there, somewhere near geniculate ganglion itself, some problem is there, all the branches of facial nerve are affected, right? Is it fine, guys? So, lacrimation gone, stapedial reflex is not proper, right? Then taste is not happening, facial expression is not proper, and one more was there. Which was the other one? In the same order, if you know, it is good. Lacrimation, stapedial reflex, salivation, taste, okay? So, all of them are gone. So, lacrimation, stapedial reflex, and all special videos are there, acoustic reflex, right, or stapedial reflex, look at that, salivation, taste and facial expression, right. Basically, the stapedial reflex protects you from loud noise, etc. So, basically, lacrimation, stapedial reflex, salivation, taste and facial expression. If all the 5 are not proper, then geniculate ganglion is affected, okay. Guys, just look at this, okay. The motor nucleus of facial nerve, that is the 7th cranial nerve, it goes around this superior salivatory nucleus, okay, and then it comes to the internal acoustic meatus. Via that it's coming to the geniculate ganglion. From here it is giving the greater petrosal nerve, then you have the nerve to stapedius, then you have the chorda tympani nerve, which is being carried by the lingual nerve to the anterior part of the tongue, right. Then you have the stylomastoid foramen, right, and via the stylomastoid foramen it is coming out. Here you have the nerve to digastric, nerve to stylohyoid, posterior auricular branch, all terminal branches, temporal, zygomatic, buccal, mandibular and cervical. 10 zebra bit my cat. So, this will make it even more clear for you as to where the problem is. If there is lacrimation is fine, then till here it is fine. If the stapedial reflex is fine, till here it is fine. Then if the taste is fine, then till here it is fine. If the salivation is fine, till here it is fine. And if the facial expressions are fine, right, at least this much is fine. That's what it says, right. There could be further problem here and all, that we are not saying. So, if all the 5 things are fine, then the entire facial nerve from the geniculate ganglion till there it is fine. If all the 5 are not fine, right? If all the 5 are not fine, definitely you can say that there is some problem before this itself, before the geniculate ganglion itself, some problem is there. Okay? Okay, bye again, bye bye.